So today we'll talk about breast reduction. And so breast reduction, as the name goes, is reducing the size of the breast. And why will a person want to reduce the size of the breast? So for various reasons, the breast may be bigger than the size a person considers appropriate for them. And normally, when the breast is bigger than normal in size, the person will have certain symptoms like upper back pain, shoulder pain, grooves on the shoulder, back grooves on the shoulder, mid back pain. So pain in various parts of the back, shoulder pain and all that. So the person will have this because of the size of the breast, weighing on, because of the weight, on the upper part of the body. Then also another issue, people with big breasts have that they find it difficult to find the right breast size to buy. This is another reason why people come to us to have breast reduction. But most people who will come to us to have a breast reduction will be symptomatic. The sense that they're going to have this long-standing shoulder pain, upper and mid back pain, some people lower back pain that we have because of the size of the breast. And then when we reduce the size of the breast, usually all these symptoms would disappear. All these symptoms will disappear. So if you are considering a breast reduction, somebody considering a breast reduction, encourage them to contact us. And the way we approach it, the first thing we do is to have a consultation. So we'll do a consultation for you. And during the consultation, we'll take your medical history, we'll examine you, and then we'll see that explain to you how the procedure works. And also, you have opportunity to ask questions, and we'll answer all your questions as best we can, based on our extensive experience. Thereafter, we'll do certain tests before the surgery to make sure you are fit for anesthesia, and to check the state of your organs. So once that is done, we agree mutually on the right date for your surgery, and then we'll do the surgery. And usually during the surgery, we'll put a drain to remove any any fluid that may collect. Usually the drain will stay in for a day or two, then we'll remove it, and then you are good to go home. Usually the downtime for breast reduction is just a few days. It doesn't have a lot of downtime as such. For most people, within 3 to 4 days, you can actually go back to your work, whilst you continue follow up with us. So, and then we can do maybe dressing changes and this, and things like that until until the swelling that you have is settled a bit and all that. So usually the skin incision we make will be healed within 2 weeks, all healed, and so within the first week, you can actually return back to your work. So you see, this is a procedure that is very beneficial, very rewarding, and will lead to relief of symptoms when we do the procedures for those who have symptoms from a big breast. So if you are considering a breast reduction, please contact us, and we'll have a consultation for you and explain the process to you, and then we can now plan to do the procedure. Some people will ask, how does breast reduction affect pregnancy? It doesn't affect pregnancy in any way. A person will get pregnant the way they would normally have gotten pregnant, with or without a breast reduction. And then some people will ask, okay, how does breast reduction affect breastfeeding? So it will reduce the amount of milk the breast can make, because when we do the breast reduction, we'll remove breast tissue, and some of that breast tissue would contain milk, breast milk making glands, and the tubes or the ducts that carry the breast milk to the nipple. We remove some of these, and because we remove some of that, the person will not be able to make may not make sufficient milk, breast milk. So that is the answer to that about breastfeeding. But it's not a big issue. The issue of breastfeeding is not a big issue, because we know that a number of people, even normally, will not make enough breast milk, so then they will need to supplement the breast milk. They need to supplement the breast milk. So that is about that question. But it's a procedure that we do very safely, and that's very rewarding, and generally people are very happy about, because most people come for breast reduction, they have symptoms, and when we do the breast reduction, the symptoms literally disappear. Like the next day, the symptoms are gone. So it's a very rewarding procedure to have. So please feel free to send in your questions. We'll be very happy to answer your questions. Just checking for questions here. So usually when you have a breast reduction, hospital stay is usually between a day or two. So most people stay for 2 days, 2 nights, and then we remove the drain and they go home. But actually sometimes you can go home the day after. We remove the drain and then you go home. And then usually downtime is just a few days. Once you are home, you can actually go back to your normal house chores and your house routine. And this does not actually, doesn't have a long, downtime. So it's something you can do, and then a few days, actually 4 or 5 days, you are back to your work. That is about breast reduction. So if you have any question about breast reduction or any question about any procedure that we do, please send in your questions, and then we will be happy to answer your questions. So some people also ask about breast lift. So when we do a breast reduction, automatically we also lift the breast at the same time. So it's sort of like having 2 procedures in one. So a breast lift is a standard part of a breast reduction. So once we reduce the breast size, we're also going to lift the breast at the end when we're closing up. And so you get both together. So we find, and then pregnancy, so you can have breast reduction before pregnancy, you can have it after pregnancy. It all depends on your particular situation. We look at your particular situation, we advise you. But pregnancy is not an hindrance to a breast reduction surgery. So we don't breast reduction for a lot of people who are still going to have babies in the future, because at the present time, they're having a lot of symptoms from having a large breast or a big breast. So if you're in that situation, pregnancy is not an hindrance. You can contact us, and we look at the situation, advise you appropriately, and we'll advise you appropriately. So if you have any questions to ask, please feel free to send in your questions. If you want to contact us, you can contact us on WhatsApp, or you can give us a call directly. And the number on which to contact us is 0815 945 1311. That is the number on which to contact us. If you want to contact us, that's the number on which to contact us. So if you want to contact us, you can reach us by call or on WhatsApp. And if you are contacting us from outside of Nigeria, you put +234 in front of the number. So in that case, it will be +234 815 945 1311 +234 815 945 1311. So that is the number on which to contact us. So if you have any questions, please feel free to send in your questions, and then we'll answer your questions. Here. So I think for today we're going to end our live session here, and then we'll be back again next Monday 5:30 p.m. If you have a particular topic in mind you would want us to talk about, please feel free to contact us. You can send us a question, the topic you want to talk about, either by DM or on WhatsApp to the number I've shared with you. And if you have specific personal questions, you can reach us on WhatsApp. We'll be very much happy to answer your question and respond to you. We're always happy to talk to our clients or would-be clients to answer questions, educate, and clarify. Here at Soft-Play Surgery, we prioritize safety. Your safety is always our number one concern. So whatever we're going to do for you, we'll put safety first. So what we do for you, what will be safe. And that's why sometimes when people contact me, they want to have multiple procedures. advice, please let's split these procedures from a safety point of view. So safety is always our first consideration.